So let's take you through the treatment. The video is speeded up because of time. So we remove the tooth, we try our little temp shell, we prepare our osteotomy. It's a simple case here. You'll see I'm using a replace drill, which I prefer in this to use for pretty much most of the implants that I place. As you heard in the previous session, we all have our own ways of doing things. And you can see how nicely the blood rises up the implant immediately that we place it. And you'll notice that we're not using a particularly long implant. Why? Well, the patient is a young patient. If for any reason there's need to retreat the case in the future, then a short implant is easier to retrieve and will be less invasive to think about. So we always plan for future failure as a possibility, although we don't expect it. We have now our temp shell. We can modify the abutment so that we can connect this to the temp shell intraorally with some resin. We just place a little silicone to seal the screw hole, a little flowable composite, and also connect the two in the mouth. And then we can lift this off, and you can see the transmucosal area is in a biologically compatible material. We can refine with flowable composite, define the appropriate space, create a screw hole so that, and the silicone in the screw hole allows us very easily then to open it up. We pay attention to details at this stage to create the right tissue support and the appropriate polishing of the surface in order to optimize everything. And then you'll see a very important step is to scrub the abutment with soap and then to disinfect in chlorhexidine so that we have a clean surface that we can replace and allow epithelial attachment, because we've been working with polishers which will leave particles of dirt and dust on the surface, which is important that we avoid. And we have to have a clean surface for mucointegration to occur. We also carried out a connective tissue graft to augment the soft tissue volume, and you can see the healing at 2 weeks with the temp shell, and you can see the veneer on the left lateral has already been placed at this stage. So in follow-up, after a couple of months, we are able now, I think at 6 weeks now, to take the impression for the final healing. You can see very nicely on the screen here, the tissue is not epithelialized down to the level of the implant. You can see a red looking tissue, which means that we've had some epithelial attachment. And now, every time we disconnect and reconnect the components, we clean with the soap and water to essentially have a clean surface. We can carry out our prosthetic treatment along with Luke and Patrick Rutten to design the appropriate substructure, a veneer ceramic using intraoral scanner and a digital workflow. And you can see the final result. This was fitted 2 weeks ago, and a little bit of laser plasty was done to harmonize the soft tissue. And you can see a 1 week follow-up of the final fit and a close-up view of that with the beautiful positioning of the implant. And you can see the bone looking very appropriate for what we would like to see. And we'd expect now for tissue maturation to occur and the papilla to grow, as it always does in these cases, over time, and we will have a perfect result.